Hello, this is Dr. Jerry Cuomo. I'm recording a case. Today it is Tuesday uh, afternoon, um, and I want to walk you through an all-on-4 case. Now, we've already fit-checked our case, and I did go over that in the last video. Now, we're going to go live with our patient, and we're going to go ahead and open up. Now this is the provisional, the temporary that she was wearing. So we're going to pull the plugs out. These are polyvinyl or PBS plugs, more of a pinkish color. We're going to switch that today to a more clear. There we go, is the third one, and then we'll look for the fourth. Let's see if that's here. It looks like the fourth came out already, so we've got a little food debris inside. Oh, there it is. Actually, it's hiding. You okay? Yep. See if I can pop that out. Let's have that other Explorer. Okay. I almost pop that out. There we go. Here it comes. There's always one little one in there that's a little stubborn. We'll get it out of there. We have that micro suction. Let's see if we can. I tried that already. The microsuction, I can grab onto that and just pull it up. Oh, here it comes. There we go. Okay. Okay, so there are screw access holes all ready to go. Again, all-on-4 case going in with Zirconia as a framework. And we did show you that in the past. Now I'll have you just open up just a hair more. Okay. I'm going to switch to a smaller driver. Okay, let's make life easy. This is a Nobel BioCare case. And these are multi-unit abutments that have been in place for some time. We started the case in April of this year, and we've gone through a number of try-ins, of which all were very successful. Our impression was originally designed so that it was joined together. All the impression copings were joined together at the impression face. So we did a open tray technique, and then after that we did a try-in and verification jig, and we're just walking you through the final steps here. If we did everything according to plan, everything should just more or less drop in today. We do have to do a little bite adjustment for our patient, so we're going to pick this up in a little bit with the try-in itself. So let me just go off view here. I'm just going to follow this over to the right, and we'll follow that right over. And so we just put that in peroxide. So we have a little dish here, and we can label them room 1, and in it goes, and it's bathing in that peroxide. Alright, so after we finish the case, this temporary will be dried and put in a safe place in case our patient ever needed us to put this back in for any reason. Now here's the final, and we're ready to go in with that. And again, as I discussed earlier, the there's no metal inside. There's zirconia frame, but you won't ever notice that. The only metal are the little hubs, and they're actually cemented to the zirconia framework and then embedded in the wrapped around in the acrylic. Now the last thing that I did before I seated my patient, I wanted to be sure that my lab didn't have any of the sealer and they did. They had a little bit of sealer that kind of rolled over to the metal, so I went ahead and double checked that. So here's a analog separate from the model. I'm just fit checking each one of these, and I now have a perfect fit on everyone without any sealer interfering with this. Now the only other place I have to really double check this right side, because we did drape some of the acrylic to cover the metal portion of the abutment. So we'll check for that. We're also going to check the soft tissue area where it compresses the tissue. We had a very, very nice try-in last appointment, so all goes well today. Should be pretty straightforward. Alright, so now what we'll do is grab a pair of cotton pliers, and we're going to slowly add our screws. And I've collectively placed them all in a little vial. Very, very small, dainty little screws. I'll just put one at a time. And slide that in. Take the next screw. That one's in. Number 3 and number 4 are next. And it's always good to check the path too of insertion. Like, see this dropped in, but boy, it was a little tight going in there. So you gotta make sure that the access hole doesn't have acrylic that inhibits the path, because some of these screws are a little angled. The screw access holes are slightly angled. Alright, just verify that goes in. That one does. This one, and as well as this one. Doesn't look like we're going to have any interference at all, so we can use this driver. And we're going to hand tighten today, and then backfill with a material called Memacil 2. And so this is a polyvinyl siloxane. It's clear, so we'll use this today, and I'll have to use a small tip with that when we go to fill the access holes. So here we go. And first thing I'm going to do is wash everything off. Alright, get everything cleaned thoroughly. You okay? I'm going to start on the left side. And just going to make sure that there's no tartar built anywhere. Or any food debris. Okay. Okay, I'll use some cavity cleanser. Cavity cleanser. Alright. And we'll rinse that off. And we'll bring in now a microsection tip, and this will get rid of some of that moisture now that's accumulated. And screw holes, and soon to be associated, there we are, prosthetic screws. So we're going to pull on her cheek a little bit so it seats. You okay? And then, okay. Just want to make sure it's down. That feels pretty good. Well, it's very passive. Yep. So this leads me to believe that we're good to go. We're going to go ahead now. You okay? Everything fine? Okay. She's not pinched anywhere, so let's go. We'll put the first one in. That one's in. And just hand tightening gently. You okay?
I'm just keeping your cheek out of the way.
Okay. And here. Sneak that in. It's got a slight angle to it. Let's see. Excuse me. No. Okay, that one's down. You okay with that? Yeah, we're good. Alrighty. Now, what I normally like to do because of temperature, I'll just hand tighten these and I'll walk away for 5 minutes and come back, adjust her bite out, and then come back and hand tighten again, and then get right to placing our material in there. It's that clear. So I'll try to give you a short segment just on that while we wait on our patient. She'll check areas with her tongue, make sure there's nothing sharp, that she's comfortable, and we'll adjust out her bite. But that's pretty much it. Now just close down. I just want to see how your teeth come together. Bite down together. Yep. I think the color and everything looks great. We did a nice job selecting the shade, and now she's got some nice looking teeth. This is Dr. Jerry Cuomo with an all-on-4 case from start to finish. We'll be back with another short segment on our case with the final placement of the plugs, and that's it. For those who are interested in this all-on-4 procedure, please feel free to contact us at area 561-391-6290. We'll be happy to answer any questions you have, and also dentists and dental students that are out there, feel free to email me. Just go to my website at www.gcuomodds.com. All right, take care, and we'll see you at our next video segment.